Stroke. Causes of stroke. Medical conditions. 1. High blood pressure, hypertension. 2. Atherosclerosis, plaque buildup in arteries. 3. Heart disease, e.g., atrial fibrillation, heart failure. 4. Diabetes. 5. High cholesterol. 6. Obesity. 7. Sleep apnea. 8. Kidney disease. 9. Cancer. Lifestyle factors. 1. Smoking. 2. Physical inactivity. 3. Poor diet, high sodium, sugar, saturated fats. 4. Excessive alcohol consumption. 5. Stress. 6. Lack of sleep. 7. Obesity. Genetic factors. 1. Family history of stroke. 2. Genetic disorders, e.g., sickle cell disease. 3. Inherited blood clotting disorders. Other factors. 1. Age 55 plus for men, 65 plus for women. 2. Ethnicity African Americans, Hispanics, Asians. 3. Previous stroke or TIA, mini stroke. 4. Medications, e.g., blood thinners, hormones. 5. Infections, e.g., endocarditis, meningitis. 6. Trauma, e.g., head injuries. 7. Substance abuse, e.g., cocaine, methamphetamine. Types of stroke. 1. Ischemic stroke, blood clot. 2. Hemorrhagic stroke, bleeding. 3. Transient ischemic attack, TIA or mini stroke. Less common causes. 1. Blood clotting disorders. 2. Vasculitis, inflammation of blood vessels. 3. Moyamoya disease. 4. Arteriovenous malformation, AVM. 5. Cerebral vasospasm. Prevention. 1. Manage medical conditions. 2. Adopt healthy lifestyle habits. 3. Monitor blood pressure and cholesterol. 4. Get regular checkups. 5. Know your family medical history. Resources. 1. American Heart Association, AHA. 2. American Stroke Association, ASA. 3. Centers for Disease Control and Prevention, CDC. 4. National Stroke Association, NSA. 5. World Stroke Organization, WSO. Lifestyle changes. 1. Exercise regularly, 150 minutes per week. 2. Maintain healthy weight, BMI 18.5-24.9. 3. Eat a balanced diet, fruits, vegetables, whole grains. 4. Limit sodium intake, less than 2,300 milligrams per day. 5. Stay hydrated, 8-10 glasses per day. 6. Manage stress, meditation, yoga. 7. Get enough sleep, 7-8 hours night. 8. Limit alcohol consumption, 2 drinks per day for men, 1 for women. 9. Quit smoking. Managing health conditions. 1. Control hypertension, blood pressure less than 130/80ths of a millimeter of mercury. 2. Manage diabetes, HbA1c less than 7%. 3. Lower cholesterol, LDL less than 100 milligrams per deciliter. 4. Maintain healthy blood pressure during pregnancy. 5. Monitor atrial fibrillation, AFib. Regular checkups. 1. Annual blood pressure check. 2. Biannual lipid profile check. 3. Regular blood glucose monitoring, diabetics. 4. ECG electrocardiogram every 3 to 5 years, ages 40 plus. 5. Carotid artery screening, ages 55 plus. Additional prevention strategies. 1. Aspirin therapy, consult doctor. 2. Blood thinners for AFib or previous stroke. 3. Regular physical activity for seniors. 4. Fall prevention measures, seniors. 5. Manage depression and anxiety. Risk factors to address. 1. Family history of stroke. 2. Age 55 plus for men, 65 plus for women. 3. Ethnicity African Americans, Hispanics, Asians. 4. Previous stroke or TIA, mini stroke. 5. Heart disease or heart failure. Resources. 1. American Heart Association, AHA. 2. American Stroke Association, ASA. 3. Centers for Disease Control and Prevention, CDC. 4. National Stroke Association, NSA. 5. World Stroke Organization, WSO. Mobile apps. 1. Stroke Risk Assessment, iOS, Android. 2. Heart Health, iOS, Android. 3. Blood Pressure Monitor, iOS, Android. 4. My Health, iOS, Android. 5. Stroke Prevention, iOS, Android. Stroke Symptoms and Warning Signs. ACT FAST. 1. Face. Ask the person to smile. Does one side of their face droop? 2. Arm. Ask the person to raise both arms. Does one arm drift downward? 3. Speech. Ask the person to repeat a simple sentence. Is their speech slurred or difficult to understand? 4. Time. Time is of the essence. Call for emergency medical services immediately if you observe any of these symptoms. Additional warning signs. 1. Sudden weakness or numbness in the face, arm, or leg. 2. Sudden confusion or trouble speaking. 3. Sudden trouble seeing in one or both eyes. 4. Sudden severe headache with no known cause. 5. Sudden trouble walking, dizziness, or loss of balance. 6. Sudden nausea or vomiting. 7. Sudden hiccups or difficulty swallowing. Types of strokes. 1. Ischemic stroke blood clot. 2. Hemorrhagic stroke bleeding. 3. Transient ischemic attack T or mini stroke. High risk groups. 1. Seniors 65 plus years. 2. Hypertensive individuals. 3. Diabetics. 4. Smokers. 5. Those with high cholesterol. 6. Individuals with family history of stroke. 7. People with heart disease or atrial fibrillation. Resources. 1. American Heart Association AHA. 2. American Stroke Association ASA. 3. National Stroke Association NSA. 4. Centers for Disease Control and Prevention CDC. 5. World Stroke Organization WSO. Mobile apps. 1. Stroke Symptoms iOS, Android. 2. Stroke Risk Assessment iOS, Android. 3. Heart Health iOS, Android. 4. Medical ID iOS, Android. 5. Emergency Medical Services EMS apps. Rehabilitation and recovery strategies. Physical rehabilitation. 1. Occupational therapy, daily activities. 2. Physical therapy, mobility, strength. 3. Speech therapy, communication. 4. Cognitive therapy, memory, attention. 5. Rehabilitation nursing. Cognitive rehabilitation. 1. Memory strategies. 2. Attention training. 3. Problem solving exercises. 4. Cognitive behavioral therapy. 5. Compensatory techniques. Emotional and psychological support. 1. Counseling. 2. Support groups. 3. Family therapy. 4. Mindfulness and relaxation techniques. 5. Medication management. Technology assisted rehabilitation. 1. Virtual reality therapy. 2. Robotics assisted therapy. 3. Mobile apps e.g., cognitive training. 4. Telehealth services. 5. Wearable devices e.g., fitness trackers. Lifestyle modifications. 1. Healthy diet. 2. Regular exercise. 3. Stress management. 4. Sleep hygiene. 5. Social engagement. Resources. 1. American Heart Association AHA. 2. American Stroke Association ASA. 3. National Stroke Association NSA. 4. Rehabilitation Services Administration RSA. 5. Centers for Disease Control and Prevention CDC. Mobile apps. 1. Rehabilitation therapy iOS, Android. 2. Stroke recovery iOS, Android. 3. Cognitive training iOS, Android. 4. Mindfulness and relaxation iOS, Android. 5. Physical therapy exercises iOS, Android. Recovery timeline. 1. Acute phase 0-2 weeks. 2. Subacute phase 2-6 weeks. 3. Post-acute phase 6 weeks-6 months. 4. Chronic phase 6 months plus.